Hi friend, welcome back to my YouTube channel Nursing King. Today we are coming on of the most important topic regarding the hypertension. So first we are discussing about the what is hypertension. So hypertension, it means the high blood pressure. As we all know, high blood pressure means hypertension. So let's in the
Definition.
so hypertension is the disease of the vascular regulation. So vascular regulation means the heart circulation, in which the elevation of the arterial pressure above the normal range. Means the arterial pressure is increased the most than normal range is called hypertension. As we all know, the normal blood pressure is 120 by 80 mm per Hg. In case of hypertension, it will be increased as the 140 to 90 mm per Hg or above that. So let's see in the picture for your understanding purpose. First artery, first you think this one artery or vein. So first one is the healthy. Why it is healthy? Because of that thickness of the wall. That artery or vein wall thickness is the normal. So more blood can easily go through that. And second one is the hypertensive artery or wall. In case of the hypertension, that artery wall thickness will be increasing. So that artery is become narrowing or obstructing. That if the blood is going through that pressure will be increasing. That can be lead to the hypertension. So I hope this is understand. Next, go through the causes and types. So first type is the primary hypertension. Primary hypertension is due to the unknown causes. So primary hypertension will happen unknown causes. The exact causes to it unknown, but some of the risk factor can be cause the primary hypertension. What are the risk factor? First is the family history. Second is the prolonged mental illness. Third is the arterial degeneration. Fourth is the hormonal and metabolic disturbance. Those are the risk factor can be cause the primary hypertension. So next type is the secondary hypertension. The secondary hypertension is happen due to the pathological condition. So what are the condition? Like due to kidney diseases like pyelonephritis, the inflammation infection of the kidney that can be lead to the hypertension. How it is leading? The kidney is not working properly, that liquid amount is increasing in our body, that can be lead to the hypertension due to the endocrine disorder like Cushing syndrome, diabetes mellitus, and some of the congenital deformities like renal artery obstruction. And some of the causes is that like excessive sodium intake. So how it is causes the excessive sodium intake? As we all know, the sodium always taking the water. So if the sodium excessive amount present in our body, that can be lead to the increased liquid amount in our body, that can be lead to also hypertension. Some of the cases obesity or smoking also cause the secondary hypertension. So next type is the borderline hypertension. It's defined as the intermediate elevation of the BP with the normal range. Is happen when the BP increase the normal range is called borderline hypertension. Fourth is the malignant hypertension. It means it is a one type of syndrome when that elevated of the blood pressure is above 140 mm per Hg. When that BP is increasing more than 140 mm per Hg is called malignant hypertension. Fifth one is the benign hypertension. It is one type of hypertension type, but it's not complicated in our body. That severity will be moderate. Sixth one is the white coat hypertension. This kind of hypertension will happen in case of any anxiety time. So it is the due to happen any anxiety portion only. If the anxiety time, if you measuring that person BP, that will be increasing. Like in case of doctor, nurse or hospital or clinic side, this kind of hypertension can be seen. So next is the pathophysiology of hypertension. So first is the change in body fluid that affect to the systemic arterial pressure. So if the body fluid increasing in our body, so that will be affect in our arterial. So that arterial pressure will be increasing. So next is the abnormalities in transport of potassium, iron and water. So if the blood volume is increasing, so that blood is unable to transport that sodium, potassium, iron, those kind of product. So if the blood is not transferred properly, so that volume that increase the potassium, sodium, it will be increasing in our blood. So that can be increasing our blood volume. So if the blood volume is increasing, that can be also increasing our blood pressure. So what kind of sign and symptom seen in case of hypertension? First is the headache, fatigue, dizziness, blurring vision, proteinuria, hematuria, angina pain, epistaxis, palpitation, breathlessness. Those are sign and symptom can seen in case of hypertension. So next is the diagnosis evaluation. First is the how your diagnosis. First you have to measuring the BP. It will be increasing or normal. Then chest ray also can be done. Urine test, blood test you have to done because of that that minerals value, sodium, potassium, it will be normal or increases. Other than you have to take the history collection, physical examination. In that you have to identify the data before, past and present history you have to taken for that patient. So next is the medical management. First is the beta blocker. So beta blocker helps to responsible for the vasoconstriction in the blood vessels. So it's one of the most important medicine for the hypertension. What are the example you can take it? Next in the antidiuretic medication. As we all know, antidiuretic medication when we are administering for the patient in case of the excessive liquid amount increasing in the patient body, in case of the we are administering the antidiuretic medication. So what is the function of the antidiuretic medication? Is helps to reduce that by escape the excessive amount of fluid from the body through the urination. So antidiuretic medication like furosemide 20 mg, triazole, those are the examined for the antidiuretic medication. Next is the vasodilator. Those drugs act for the blood vessel dilation and open the blood vessel by relaxing their muscle wall. It helps to the relaxing the muscle wall and decrease the blood pressure. For example, nitroglycerin 15 to 12 mg. Next is the calcium channel blocker. So calcium antagonist, they are used to the decrease oxygen demand of the heart and improve the coronary artery blood flow. It helps to the oxygen blood flow to the heart. For example, verapamine for administering that empty stomach only. Next is the what are the nursing management. First is the assess the anxiety level of the patient, take the medical history of the patient, ask diet pattern of the patient, and assess the educational level of the patient. Those are the nursing management. Next is the complication. So what are the complication can be seen in case of hypertension? First is the heart diseases. Obviously heart diseases can be happen. Second is the renal failure, cerebral hemorrhage, and angina pectoris can be seen in case of hypertension. So I hope this video helpful for you. Please like and subscribe my channel Nursing King. Thanks for watching this video.